Hey family, this is Dr. G, and today we are discussing men's sexual health and why it's important in this day and age with all the health issues that men have been dealing with. I think I want to spend some time to just discuss the anatomy, physiology, and the importance of this topic to everyone. So, these are three different aspects of why it's important for us to focus and take a deeper dive into men's sexual health. The preventative side, from a quality of life standpoint, and the social benefits that we get when we focus on improving men's sexual health these days. So, the male reproductive anatomy. Let's talk. Everyone knows this. Biology 101 from back in high school. You have the obviously the starting off with the penis, the testes, the epididymis, vas deferens, the prostate gland, which we all know of, especially it's a big one when we're talking about cancer, and the seminal vesicles. So this is just a basic overview and a diagram here of the male reproductive anatomy. Physiology now, basically how things work. So this slide kind of gives you an idea as to, based on each organ that's important in the male reproductive anatomy, what it does and why it's important. So, normal mechanism of an erection. Okay, so it works on many different levels. You have a nervous side, venous, as well as arterial or vascular side. So with the nervous system, it basically has to do with the signaling coming from the brain telling the actual male penis that, hey, you know what, we are aroused and it's time for us to get filled with blood through the vascular system. And that increasing blood flow through the arteries causes the erectile tissue to become engorged. And on the venous side, what happens is, to prevent the blood from leaving, there is compression of the veins. So arteries lead the blood into the male organ, and the veins contract and prevent it from leaving, thus leading to the formation of an erection. So, what exactly is erectile dysfunction? Let's talk about that for a while. By definition, it's basically the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. So that's it. That's cut and dry what it is. It does affect millions of men worldwide as they age. It's known colloquially as impotence, and some of the symptoms which we mentioned before are difficulty in getting an erection, difficulty with maintaining one. So even though you can get one, if you can't maintain one, that qualifies as erectile dysfunction. And overall, for men who are suffering with this, you have a reduced sexual activities because of decreased interest, which is a problem. So everything just kind of barrels into each other, and this is where we see a lot of issues for men in the sexual health. Some of the main causes of erectile dysfunction, we all know them. This is a health issue for men, depending on what other chronic conditions they have. Let's talk about it. Cardiovascular. That is when you have, on a scientific level, plaque buildup within the arteries. So pretty much the penis is an arterial organ just like the rest of your body. So men who have issues with, I would say, coronary artery disease or heart disease, most likely can have some difficulty with erections because of plaque buildup in the arteries. Diabetes, bane of existence in public health and in health worldwide. Diabetes itself causes damage to nervous tissue, and as you know, you do need the nerve, so that's signaling to get to the penis to be able to achieve an erection. Obesity, that's a big one. When you're overweight or have excess body fat, there's a lot of dysregulation, the hormonal signals in your body, and this is where most of the issues come from with regards to obesity and sexual dysfunction in men. Now, hormonal issues, low testosterone, that's a big one. That decreases libido. You decrease libido, which libido is basically a fancy way of saying your urge to want to be intimate. So decreased libido, big problem because of low testosterone. Neurological disorders, that kind of feeds in a little bit into the diabetes, but conditions as we see here, like Parkinson's disease, MS, all these different things where you have decreased nerve signaling can lead to erectile dysfunction. And of course, medications. There are a lot of medications prescribed in health that can lead to erectile dysfunction. Some examples are blood pressure medications, some antidepressants, and even some antipsychotics. So it's a double-edged sword for those men who are dealing with things like anxiety, depression, mood disorders, and then we have to put them on these medications to help their mood, but that effectively kills their libido or even kills their functioning as a man with regards to hormonal imbalances in the body because of these medications. So here are a few causes that are very important. As you can see, different aspects of health can definitely affect a man's sexual performance. And let's not forget the psychological causes of erectile dysfunction. So, most men, they get in their heads where, that they have one bad game, so to speak, and guess what? The whole life is ruined. And it's a self-fulfilling prophecy if they're not careful. So high levels of stress can definitely affect sexual performance. If you're suffering with anxiety, especially around the intimacy conversation, that can cause issues. Depression itself, that's a big one where, that neurochemical imbalance in the brain, which leads to depression, can cause issues with erectile dysfunction. And obviously relationship issues. So if for men, if they are not open and honest with their partners as to issues they may be having, this can lead to them becoming more, introverted and not really diving deep into why they may be having issues with their partners, which is a big problem because guess what? The partner is there to help you with this journey. And if it's a situation that you're having, you might be surprised with the response you get from the partner in terms of encouraging you and helping you to get the help you need to be able to continue to be the person you want to be. Now, pathophysiology of erectile dysfunction. Let's talk about that. Like we talked before, impaired blood flow, nerve damage, hormonal issues, and psych issues, meaning stress and anxiety. All these kind of build into each other, and it's not uncommon to have men who have one or more, well, two or more of these particular issues coexisting, leading to the issues with erectile dysfunction. Now, things you can do, how diet can impact erectile or sexual dysfunction in men. So you want to get foods rich in antioxidants. You want to get foods rich in vitamins and minerals, and it is important to hydrate. Because we know adequate hydration is important for overall health and wellness anyways. So this is a good place to start. Getting regular exercise. You saw that some of the main conditions that lead to difficulty with erectile dysfunction are basically metabolic issues, high cholesterol, diabetes, obesity. All these three are big ones. And if we're not careful, and if men just become more sedentary, those conditions get worse. And if those conditions get worse, you can see worsening erectile dysfunction. So it is important for you to definitely get regular exercise, improve your cardiovascular fitness, because that ultimately leads to boosting your natural hormone levels like testosterone and helping reducing stress and anxiety, which could be contributing to your difficulty with erectile dysfunction. Sleep is important, guys. Gotta get good sleep. Sleep is when your body goes into repair. This is where energy stores are restored. This is where your body begins to kind of cleanse your insides, and it's important to get good adequate sleep. 6 to 8 hours is recommended, especially in this day and age where we don't get enough because we're always in front of a screen. It's important to get adequate restful sleep, and speaking of sleep, you have to also think of disorders like obstructive sleep apnea. This is a big one because this particular disorder itself will disrupt your sleep, but can also cause negative impacts on your cardiovascular health, metabolic health, as well as your social/interpersonal health with regards to stress and anxiety. So it is important, if you think you might be someone living or dealing with sleep apnea, talk to your healthcare professional, get tested. The classic thing is, oh doc, he stops breathing in sleep. That's a big one I hear from spouses when they talk about their husbands. So I think it's important that if you think you might have or you might be dealing with some sleep apnea, please definitely get checked. Stress management, meditation, yoga, deep breathing, all these things are good because what those do is they help to take down your sympathetic drive or your stress drive and kind of get you into a place of more zen and well-being where you can tackle issues a lot better, and less stress leads to better sex. Alcohol and tobacco. Let's talk about those two. Two big vices in the Western world, and actually the worldwide. The impact of these on sexual performance is huge. Alcohol itself will reduce desire because alcohol is a natural CNS depressant, and it can reduce performance because alcohol dehydrates, alcohol slows down nerve firing. So it's not uncommon for men to drink a little too much and then not have the best game in intimacy wise. And once again, when this happens for a lot of men, they get into their heads and they begin to think, oh my god, what's wrong with me, what I do. Smoking, it's a cardiovascular nightmare. Smoking increases plaque buildup, increasing inflammation inside the arteries. And we all know once plaque builds up, like in the heart or the rest of the body, and it can do it in the penis as well, where blood flow slows, and then guess what? Erectile dysfunction shows. So you want to make sure that if these are two vices that you're struggling with, get the help you need to get rid of them. Because they're both addictions, which are diseases in my opinion. So it's something that if you can do it on your own to stop it, great. But the majority of people need some sort of help, whether it be clinical or even from family support, to get these particular vices under control, especially if you're having erectile dysfunction issues. Building intimacy is important. More and more, I'm encouraging my male patients to discuss it with their partners if they're having any sort of issues with erectile dysfunction or just not feeling themselves. So it is important that you have open communication with your partner. Let them know what you're feeling. Let them know how you plan on coping with it. Kind of build your own mini village around this issue, because it is important to you as it is important to your partner. It's something that you definitely want to think about. Now, there are many medical treatments out there to help with erectile dysfunction. This is the beauty of medicine in this day and age. I mean, most of us have heard of the Viagras, the Cialises. I mean, there are herbal supplements like ginseng, which is a nootropic. There's also L-arginine, which is meant to kind of increase nitric oxide, which increases blood flow. But you definitely want to talk to your healthcare provider about these particular treatment modalities if you think you could benefit, or if you're having erectile dysfunction issues. I would recommend, before jumping into the medication space, have a good talk, get a good physical exam and testing before diving into these medications, because you'd be surprised sometimes that issue, erectile dysfunction, may not be caused by what you think is being caused. So have someone be with you on this journey to figuring it out. Now, let's talk about what's new and hip in dealing with erectile dysfunction. Shockwave therapy. Now, we all know shockwave therapy in medicine. We do it for, the urologists use it for kidney stones. The orthopedic doctors or pain management guys use it to help with chronic pain and to help with joint issues. But we can also use shockwave therapy to help with erectile dysfunction. So it's a non-invasive treatment. It's low intensity extracorporeal shockwaves to treat erectile dysfunction. Big. Initially developed for breaking down kidney stones, like I mentioned, and helping with wounds, but its applications for erectile dysfunction have been approved and has been shown to increase blood flow in the erectile tissue and help break up scars that can occur within the penile tissue. So it is new, it is pretty big, and it's pretty effective for a lot of men, and they can see effects last a long time. So here's some of the benefits of using shockwave therapy for erectile dysfunction. So you increase the ability to achieve and maintain an erection, right? The symptoms are reduced, performance increased, overall improvement in sexual health is achieved by men, and you can get long-term effects of this particular treatment, which has minimal side effects. It's non-invasive, and the reason why we get that is that it is truly a regenerative technique or procedure that we perform using the shock waves on the penile tissue. Very important. How does it work? Everyone's like, doc, I hear shock waves, but how does it really work? So what happens is when we are treating erectile dysfunction, you're basically placing the transducer on the penis near where the erectile tissues are, and you're creating what we call micro trauma. It sounds worse than it really is, but it's basically tricking the cells into going back into healing in that area. You get new vessel formation. You have improved blood supply in the penile tissue. The technique itself, the shock waves, help to increase nitric oxide, which we know nitric oxide helps to enhance, is a natural vasodilator, so you get increased blood flow in the blood vessels. and there is tissue regeneration which occurs in the tissues after we use a shock wave. So what happens is, like I said, sound waves are created, they stimulate the cells within the penile tissue, increase blood flow, increase blood vessel formation, which ultimately leads to achieving better, stronger erections for men, and no downtime, not painful, and they can go back to doing regular activities right after the procedure. So how effective is it? A lot of papers out there, studies to show that using shockwave therapy for erectile dysfunction is a game changer. Unlike some more invasive techniques of placing in implants or injections into the corpus cavernosum, which are effective treatments, this particular one is for men who have mild to moderate erectile dysfunction. And obviously, this is after you do an assessment with your qualified healthcare professional or doctor, and they tell you, hey, you know what, based on what I'm hearing, based on the physical exam, based on our assessment, it looks like you might have mild to moderate, not severe, because a lot of times people who have long-standing severe erectile dysfunction for reasons like long-standing diseases or surgery or trauma, those are more difficult cases to work with, and typically we don't see the results that we would like to see. But if you're someone who fits, after going through the criteria and going through the treatment, fits the treatment profile, definitely recommend giving it a try for yourself, because one, it is a rejuvenation technique and procedure, and the benefits are amazing. So these are a typical protocol, but it all depends on who's performing it and their technique. It's usually 6 to 12 sessions, 1 to 2 sessions per week. Each session is about 15-20 minutes. And this is just based on the study. I mean, I know in clinical practice, we do typically 2 sessions a week for 3 weeks back to back, and that's where we see a lot of gains for the men. For the longer sessions are those for who have more moderate or more difficult symptoms or to treat, but in essence you can get away with 6 sessions and do really well. Here are some of the studies that I reviewed in preparation for this talk, so you guys can feel free, check them out, do your own research, because especially this is your body to be able, and it's a good thing for you to do on the regular. I hope you guys enjoyed. I love serving you. Remember, erectile dysfunction in men, it's a big health topic, especially with all the issues we're seeing in health today. And it's not just dealing with sex, it's also looking at cardiometabolic health, psychological health, and well-being of men.